We are also inviting George Wafula, representing Mastercard Foundation, to come to step here forward so that we can kick off our first session. So with this session, we'll be having opening remarks from our guests. I will start with Africa CDC representative, Dr. Med, who is going to give us his opening remarks. You're welcome, Dr. Med.
Good morning, good afternoon, good evening, colleagues, especially for those who are online, depending on where you're joining from. Honorable Minister of Health, thank you very much for accepting to host us here in Kigali. And as we were saying, it has rained this morning, so this is a very big blessing. I'm already looking forward to a very successful meeting, but do pass our regards to the government and the people of Rwanda for accepting to host us here in Kigali. The US CDC representative, colleagues from all the member states represented here physically, and those who are joining us online, Mastercard Foundation, our very key partner, all colleagues from Africa CDC, from Rwanda who are supporting this event, ladies and gentlemen. Let me start by acknowledging the fact that this pandemic has brought a lot of challenges, but with it has come a lot of opportunities as well. And it is how you and I are going to react to the challenges that is going to determine the direction that this pandemic will take on the continent and eventually globally. Our continent, Honorable Minister, is at a great crossroad because on one side, we are faced with very harsh realities of the pandemic. Most of our economies are based on individuals going out on a daily basis to look for sustenance. And if they don't do that, then they don't have resources to be able to look after their families. So we are even more disadvantaged than many parts of the world. So that is on one hand, the realities of the pandemic. But at the same time, there is the opportunities that come with difficulty. And we are really looking forward to exploring some of those opportunities together during these days that we are going to be here in this meeting. We are also reminded how unequal the world is. Africa, we have barely done 7% fully vaccinated. Some countries are doing better than others. But for the full continent of 1.3 billion people, we've only done 7%. It means that we have a long way to go if we are to reach our goal of 70% by next year. This vulnerability is reflected by the fact that new variants are going to come. Omicron has caused a lot of panic globally, but it is one of the 5 variants of concern. And if we don't do what we need to do quickly, other variants will come. This is the reality of viruses. And our continent is even more disadvantaged because of travel restrictions that are being related particularly with this new variant. The opportunities that we have that we can be able to use to chart the course in our health security agenda on the continent includes the building of transformative partnerships. And that is why we are here for the next 1 week. A key opportunity is of course, the need for us as Africa to not only accept that we need a new public health order, but also to actively implement what, as Africa CDC and the Africa Union, we have proposed of a new public health order in health security, not just on the continent, but globally. This new public health order is underpinned by 4 pillars. The first is our institutions on the continent and at country level. We need to strengthen our institutions so that we are able to be better prepared if any time a health emergency were to come on our shores. Second is health workforce development. We must build our capacity and capability on the continent by having the correct experts, by having them in the correct numbers, and by ensuring that they are available to be deployed across the continent, wherever it is that there may be some challenges in terms of health emergencies and securities. The third pillar is how do we secure our health commodities that we need for health security. We need to manufacture locally what we know is going to be part of our response and preparedness activities. We must manufacture simple things like masks and gloves. We must manufacture complex things like vaccines and everything else in between. It is the only way that we will not be vulnerable the next time that a large outbreak occurs or another pandemic. And I assure you the next pandemic is not going to be 100 years. As human beings, we've become very indisciplined. We go into caves where we are not supposed to be. We go into forests where we are not supposed to be.
Recording in progress.
That, were never designed for human beings to eat, etc., etc. So that next pandemic may actually be much closer. And the fourth is transformative partnerships. We can't do it alone. And the partnership starts within the country. Are we working together as different institutions within the country, as public and private, as research institutions and academic institutions? Are we working together locally? Are we generating domestic financing? Then we can go outside and see who else out there within Africa and beyond has the knowledge and the capabilities that we need to improve our own preparedness and response. So these 4 pillars are what underpins the new public health order, which we hope is going to be brought into reality through this Saving Lives and Livelihoods program that we have started the journey with you for. One of those really transformative partnerships is the partnership with the Mastercard Foundation. $1.5 billion over a period of 3 years, most of which is going to be really spent within the first 6 months or so, is a very huge and unprecedented support to not only the African continent, but to health, to public health specifically. The main goal of this program, the Saving Lives and Livelihoods program, is really there are 4 big things that we want to do with the support from Mastercard Foundation. The first is to procure vaccines. And that procurement is already going on. And we'll start, I think the distribution, Meravi, has started already. And we will continue to distribute those vaccines that we are purchasing as consumption also increases at country level. So we really urge you as a member states to ramp up that consumption so that we can be able to ensure we get to procure all the vaccines and accessories that we need. So this is the first very key goal of the SLL program. The second is to support deployment of those vaccines. So not just to buy them, but also to support countries to be able to deploy and get those vaccines into people's arms. It's extremely critical, particularly at this stage, when our vaccination rate is so low, and yet we are faced with many challenges of not only the different variants that are out there, but also when time passes, the human being tends to forget. And we need to catch the public as quickly as possible to ensure that we are getting to vaccination and not just to purchasing of vaccines. The third goal is to strengthen manufacturing of human vaccines here on the continent. We are talking a lot about COVID-19 vaccines, but there are many other vaccines that we also need to secure. As you may have heard, we are only currently manufacturing 1% of the vaccines need outside of COVID. We are only manufacturing 1% of the vaccine needs on the continent. So 99% is being imported, a situation that certainly gives us, well, it's a great risk when you have an emergency like what we have now, but it is also a great opportunity as now we are getting into local manufacturing of human vaccines. The fourth goal is to strengthen Africa CDC's capacity and capability. And this grant is securing more staffing for Africa CDC. This grant is providing the staffing an environment where they can be able to work and work well for the continent. So distinguished representatives of member states and partners, your role is crucial for the success of this ambitious program. As Africa CDC, we'll do everything that we can to be able to coordinate the activities, but it is you who will be the boots on the ground. It is you who will be the voice, who will be the ears and the eyes of this particular program. So we are really looking forward to working together so that we can be able to ensure that the SLL program is a success. And it is not by chance that we are here in Kigali today. It is not by chance that 2 weeks ago we were in Morocco. We have carefully looked at where the vaccination rollout programs are working well, and we really would like to ensure that those countries that we've already designated as our centers of excellence can be able to provide us with an opportunity to see firsthand how they are doing it, so that when you go back home, you feel challenged enough and you transform your own programs back home. So we are very proud to be here in Rwanda because Rwanda has been designated as a vaccination center of excellence by Africa CDC. And we hope that the model we will see during this week, we can be able to adapt when we go back home and ensure even faster vaccination. During the week of 22 to 26 of November, 14 member states gathered in Morocco. And there they were able to share best practices, and they were also able to see how Morocco has deployed some very, very good logistics across the country to be able to achieve up to 80% of its population vaccinated. It's very impressive, and it is something that we hope will be the motivator for us to be able to do better. Here in Rwanda, the government here has demonstrated the prospects and possibilities that exist. And they have made very big steps, as the minister will share with us, in as far as vaccination is concerned. We want to learn from those who are ahead of us. And we congratulate you, Honorable Minister, and your team for driving that process that is giving us very good hope that Africa can be able to make it, and not just make it, but make it well. This workshop has also deliberately brought together member states and implementing partners. It is not just the countries that are here, but also our implementing partners on the ground. And we need to interact together. We need to plan together so that when we go back, we work as one team, ensuring that our countries and the members of the public are actually receiving the support that we need. And we are doing this because time is very short. This is what we should have been doing probably in June, if not earlier. But because of resources and because of difficulties of travel, we've had to come together during this final month of this year. So we look forward to having some very key discussions during this week. We look forward to reaching a good level of understanding of what we need to do. And we look forward to agreeing that whatever we need to do needs to be done quickly. We should have done it yesterday, but today is the next best opportunity for us to be able to ensure that Africa is achieving its goal of 70% by next year. Finally, is to remind ourselves that we are within the Africa Union family, and this particular program is very well aligned with the aspirations of our socioeconomic blueprint in Africa, Agenda 2063, the Africa we want. And if you and me play our part, then that part of Agenda 2063 will have been achieved for improving the way in which we plan and respond to the health security agenda on the continent. I thank you, and I wish all of us really successful deliberations over the next few days. And out of this, we are looking forward to hearing that at country level, you have transformed your response, and the numbers of those vaccinated will continue to rise in the coming weeks and months. I thank you.
Thank you very much, Dr. Ahmed, for the remarks. Now let us welcome Dr. Thierry, Director, US CDC Rwanda.
Nous allons à présent accueillir
Honorable Minister, dear Dr. Ahmed, representative of the Mastercard Foundation, dear colleagues, good morning and welcome to Kigali. Soyez le bienvenu à Kigali ce matin pour cette réunion importante. My name is Thierry Rolls, and I'm the United States Centers for Disease Control and Prevention Country Director for Rwanda. I was struck the first 2 days and this meeting of the importance of the meetings, and I think two key concepts came to the forefront that keep ringing and ringing and ringing. There are partnerships and capacity building, and so I thought that let me give an example of our organization, how these two concepts have played into the work that we're doing here in Rwanda. We're actually going to celebrate next year our 20 years of collaboration with the government of Rwanda, and we've achieved quite a bit over this parcours. As in many other countries, there are US CDC teams on the ground working with government colleagues and implementing partners, implementing the PEPFAR initiative, the President's Emergency Plan for AIDS Relief. And basically, we're not just providing quality services, but we're also implementing systems and strengthening the systems. And here in Rwanda, like in other countries, we've worked on surveillance systems, we've worked on strategic information, and we worked on strengthening the laboratory systems as well, proficiency testing, making sure that the different database collaborate with each other and that they can share the information. And so important events that I think can transcend into other areas as well. Not only for HIV, but I think these strengthening on this leverage of these programs have also shown their benefit when emerging diseases appear, like we had not so long ago with Ebola in the DRC, and also now with in the midst of COVID with that. And so our teams is also strengthening and helping the government in the global health security efforts, and we've done quite a bit on that. Bringing now to the concept of capacity building, I think our teams have worked with Rwanda government as well to implement what's called the Field Epidemiology Training Program. It's a premier program to train people in the concepts of disease surveillance, epidemiology, etc. And so in Rwanda, since 2009, we've had we installed the advanced program, which is a 2-year master's program. And I'm glad to say that we have already 5 cohorts have graduated, and a 6th cohort is in training as we speak. And so a total of 64 graduates are in various levels at the ministries and contributing quite extensively to the success of combating the pandemic. And so needless to say that all these, and then we also have the frontline the frontline course, which is a shorter course, a 3-month course, where you work with district or provincial health level people to work on disease surveillance and helping out in that. So this is to illustrate the importance of capacity building at various levels. And needless to say that continuous quality improvement in the various activities that are being done is very important to make sure that the standards of services provided is important. And so I hope that during this week and this coming days that these concepts will also be discussed, and the CDC Rwanda team, and I'm sure my colleagues from other countries as well, are happy to collaborate wherever we can. And so thank you again for inviting us, and I hope you will have a very good and fruitful workshop in the coming days. Thank you.
Thank you, Dr. Thierry. Now we would like to hear from
Dr. Thierry.
Representative. If George Wafula is there, this is the time for his remarks. If not, let us welcome Honorable Minister of Health in Rwanda to come and give his remarks and declare this workshop open. Thank you.
Dr. Ahmed, Deputy Director General, Africa CDC, Dr. Thierry, CDC, US CDC Country Director in Rwanda, the representative of Mastercard Foundation, Dr. Albert, representative of RBC, Rwanda Biomedical Center, distinguished ladies and gentlemen, dear participants to this workshop, good morning. Je me joins aussi aux collègues qui viennent de présenter ses remarques pour souhaiter la bienvenue au Rwanda, mais par aussi de convenance, parce qu'il y a plusieurs personnes qui suivent mes remarques. Je vais le faire en anglais, mais je n'hésiterai pas à la fin de clôturer en français. Allow me to begin my remarks by saluting the program Saving Lives and Livelihood, a partnership for COVID-19 vaccination in Africa. It is planned for next 3 years. It is important to reach a target of 60% of COVID-19 vaccination coverage for the entire population across the African continent to mitigate the impact of COVID-19 and allow social and economic recovery. To optimize efforts towards COVID-19, Africa needs vaccine equity with effective governance structures that emphasize the strengthening of national, regional, and continental institutions. Rwanda achieved a lot in terms of COVID-19 vaccination efforts alongside other efforts related to the management of the pandemic. Purposely, the country adopted a multidisciplinary approach to cope with the pandemic. Additionally, like in other countries, we have a national coordinating mechanism to provide strategic orientation and decision to control COVID-19. We have also the National COVID-19 Vaccination Joint Task Force with clear roles and responsibilities. We have a number of donors and funders currently supporting our COVID-19 vaccination efforts. They include Gavi, WHO, UNICEF, World Bank, USAID, SFH, while the core technical and implementing partners include CHAI, WHO, UNICEF, PSF, and Ingobi. The National Deployment and Vaccination Plan has guided the effort of vaccination with the aim of introducing COVID vaccines to protect the population and minimize socioeconomic impact by reducing COVID-19 morbidity and mortality. Priority population have initially included health frontline workers, elderly people beyond 65 years old, and people with non-communicable diseases, people living with disabilities, refugees, inmates, and other frontline and at high risk workers. Our vaccination have expanded, and we are now vaccinating people from 12 years old, and the booster dose administration is underway for those 30 years old with NCDs, and the booster is also given systematically to all Rwandese beyond 50 years. Rwanda experienced the new vaccine introduction, including childhood and adolescent vaccinations, hepatitis B, and Ebola vaccination for healthcare workers, made a basis of successful rollout of COVID vaccination. Vaccine storage capacity of the country was expanded in December 2020 to include ultra-cold storage capacities by purchasing additional deep freezers. The cold chain equipment has been paramount in receiving the vaccines. COVID-19 vaccines administration sites have been both public facilities and private health facilities as well. The country has so far reached the vaccination coverage of 48% with at least one dose countrywide, and 29% of the entire population fully vaccinated. The objective is to reach 70% of the entire population fully vaccinated by December 22. Distinguished guests, dear participants, really shaped the implementation of COVID vaccine introduction. However, there are still challenges to overcome and gaps to close, like strengthening cross-border collaboration in terms of pandemic response, and keep building resilient health system to contain the pressure as a result of redefined volume of work in health facilities in relation with routine vaccination for COVID-19. The same pressure applies to the entire Ministry of Health in its core mandate, which goes beyond management of COVID-19. We should innovate with additional strategies to ensure that the entire health system remains focused to deliver in all its components. In the perspective of this new public health order with 4 pillars, as mentioned by Dr. Ahmed. In fact, we need an innovative, ambitious, and resilient health system. I hope that this visit become a fruitful exercise in defining the needed support to each member state here present. As I conclude, I'm pleased to welcome you in Kigali once again and wish you an enjoyable stay, fruitful deliberation during this meeting. Thank you so much for your kind attention. Je disais que ça nous fera plaisir de partager avec vous ces quelques jours de cet atelier. Nous aurons bien sûr les présentations qui vont être faites, mais il y a aussi une session de visite sur terrain pour que nous puissions partager ensemble notre expérience sur terrain sur tous les circuits de planification de vaccins, leur acheminement au pays et leur distribution sur l'ensemble du territoire, tout ce que nous avons pu mobiliser comme ressources humaines, matérielles et autres pour que les vaccinations puissent avoir lieu, et surtout l'engagement de partenaires sociaux pour mobiliser la population à accepter la vaccination, ce qui est probablement un des défis que nous faisons, auxquels nous sommes confrontés tous, d'amener les populations à accepter la vaccination. Je crois que nous aurons pas mal de choses à partager avec vous, à entendre comment aussi vous le faites dans vos pays. Ça nous fera plaisir d'avoir un échange fructif sur ces aspects. Et donc, je vous souhaite un bon séjour à Kigali, espérant qu'en rentrant, vous aurez pas mal de bonnes choses que nous aurons partagées tous, chacun venant dans son pays, pour que nous puissions rentrer et être sûrs que nous allons mettre en œuvre tout ce que nous avons découvert comme innovation auprès de pays respectifs qui sont ici. Je vous remercie.
Minister and distinguished platform guests, including our Deputy Director, we'll now shift to phase 2 of our program to give everyone an orientation on governing the purpose of our meeting today. And first of that will be introduction of the member state to the implementing partners. If I borrow the word of Dr. Mohammed, he says the purpose of our meeting is to create an ambient environment where the member state meet and interact with the partners. So without much ado, I will call on Dr. Marari to do the introduction. Thank you very much.
This thing is difficult. All right. Good morning, Honorable Minister and all delegates, all protocol observed. So this session is introduction of member states and implementing partners. Maybe before that, for the interest of time and for Honorable Minister's sake, we will give overview of the whole program, and I will invite Dr. Taji. Immediately after that, we'll have a group photo. Then while we send Honorable Minister, then we continue with that specific session on introduction of member states and partners. Dr. Taji, please. Thank you.
Good morning, Your Excellency, the Minister of Health of Republic of Rwanda, Deputy Director, Africa CDC, and the US CDC representative. Distinguished member state, partners, ladies and gentlemen. So I will take a short time to quickly introduce us to what this program is all about. So let me start with the objective of why we are here for the next 5 days or 1 week. So one is to foster relationship building between member states, the implementing partners, in preparation for the implementation of this program. Number two is to use the experience from Rwanda. We all see how Rwanda has been able to roll out the COVID-19 vaccination in terms of procurement, in terms of storage, in terms of distribution to the last mile, much more importantly, in terms of creating the necessary demand for the COVID-19 vaccine and getting it into people's arms. Number three is to also other member states, because we know that quite a lot of our member states also have what we describe as best practices. So this is a perfect opportunity for us to learn from among ourselves. What is it that is working and what is it that we need to adjust in terms of program implementation in our respective member states? The fourth bullet there is to provide orientation, for some of our new implementing partners, and also to allow for the different implementing partners to interact with our member states. The number fifth there is this particular workshop will also serve as an avenue to provide some sort of technical support, because we have faculty that is made up of our colleagues from Rwanda Ministry of Health, Rwanda, the Biomedical Center of Rwanda, and from Africa CDC. So as much as possible, this is also an avenue to impart skills and knowledge into ourselves as far as rolling out vaccines are concerned. And in terms of outcome, at the end of our 5 days here, we want a session whereby each and every member state, together with the different implementing partners, are actually ready to begin what we describe as micro-planning, because we know that for us to effectively roll out a vaccine, COVID-19 vaccine in particular, we need a very robust micro-planning. Next. So this is what the 4 days will look like, and I'm sure we have shared this with our participants. Next. Okay, so this is what day one will look like. We are currently in session 2. Next. 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 Very good. All right. So let me quickly take us through what this SLN is all about. We all know what Africa CDC is all about. Africa CDC is a specialized technical institution of the African Union, intergovernmental organization. And Africa CDC actually aim at strengthening the capacity and capability of member states, public health institutions, and other, health institutions within our member states in general. The second thing there is the mission of Africa CDC is that of creating a safer, healthier, and prosperous Africa, which is to align with the socio-economic blueprint of the continent. That's Agenda 2063. The the third bullet there is emphasizing on the operating model of the Africa CDC. This is to further emphasize that